Hi Andy, I'm Dr. K. Chanakya Kishore, Senior Cardiologist, Kera Hospitals, HITEC City, Gachibowli. Today is World Heart Day. It is 29th September of every year we celebrate World Heart Day. And the theme of this World Heart Day is use heart for every heart. Means we should educate people surrounding you regarding the precautions we should take, our lifestyle we should follow so that we can prevent heart attacks or sudden cardiac deaths. So nowadays we are seeing sudden cardiac deaths or arrests in young people, those who are doing regular exercise or in gyms or doing some activity, all of a sudden they become unconscious and they die. So what could be reasons for this sudden cardiac arrest or sudden cardiac death? Sudden cardiac death means people will be having any sort of health problem 24 hours prior to this sudden cardiac arrest, and development of symptoms like any chest pain, breathlessness within a span of just 2 to 3 hours, and they die suddenly. So that is called sudden cardiac arrest or death. So usually these type of people, they may be having some genetic disorders like sodium channelopathies anta, Brugada syndrome, congenital long QT syndromes, or anomalous coronary arteries. Coronary arteries ante మన హార్ట్లో బ్లడ్ సప్లై చేసే రక్తనాళాలు. సో ఈ రక్తనాళాలు నార్మల్ పద్ధతిగా కాకుండా దే గో అబ్నార్మల్ వే, దట్ ఇస్ కాల్డ్ అనామలస్ పాత్వే అంటారు. సో దీస్ అనామలస్ coronary arteries, they go between greater arteries like pulmonary artery and aorta. During exertion, heavy exertion, both arteries, because of heart rate and excessive pumping of the blood into the body, they enlarge in size, they dilate in size, and these anomalous coronary arteries, they get compressed during heavy exercise or exertion. So all of a sudden, because of compression of these arteries, the blood circulation to the heart will come down and patient will go into ventricular fibrillation and they die. Similarly, congenital long QT syndromes, Brugada syndrome, these are all rhythm related abnormalities. Another problem is arrhythmogenic right ventricular dysplasia. People or patients who have these problems, if they don't know any prior history, they are unaware of these problems, and once they submit themselves for heavy exertion or strenuous exercise, which is not body is not accustomed to sudden heavy exertion, they die of ventricular arrhythmias. So with ventricular arrhythmias, they go unconscious and they die. So the another thing is cardiomyopathy, hypertrophic cardiomyopathy. These people also, they develop arrhythmias and they die all of a sudden. So these people, if they have any family history of sudden cardiac death or hypertrophic cardiomyopathy, these people should be evaluated from the beginning, that is the first decade onwards. And once they identify these people are also having susceptibility or a tendency to develop these arrhythmogenic tendencies, they should take proper medical attention, periodic monitoring, and doctor's advice as and when it is required. Thank you.